Hair loss is one of the most misunderstood problems in medicine. If you're losing hair and someone just told you it's just testosterone, it's just genetics, just take biotin, that's not wrong, it's just wildly incomplete. And if you don't understand the system, you're gonna end up treating it wrong. Hair loss comes up quite a bit in our clinic. It comes up during testosterone consults. Whenever we talk about thyroid, with GLP One weight loss follow-ups, and women's hormones discussion. Hair isn't just cosmetic, it's a reflection of your physiology. So today, let's dive deep into it and cover a few topics. What we're gonna cover is how hair actually works, testosterone, DHT, GLP-1 medications, thyroid, metabolic stress, blood flow, what actually works, what's hype, what may have some use that you can do at home, and overall realistic expectations with all this. Because once you understand the system, hair loss starts to make a lot more sense. So let's start with just hair biology, because this is where a lot of people get it wrong. Hair does not run in real time. It actually runs on a delay. Each follicle cycles independently through the anagen growth phase, which is 2 to 7 years, catagen transition, and telogen resting and shedding phase, which is about 3 months. At any given time, there's about 10 to 15% of your hair is already in the shedding phase. And so if something stresses your body today, like illness, weight loss, hormone changes, thyroid changes, you won't see shedding today. It will likely pop up in 8 to 12 weeks. Hair is basically that friend who brings up something you did 3 months ago and ruins your day. And the same can apply to treatment. If you start something today, we're not gonna judge its efficacy in a week or two. Hair runs on a 90 to 120 day clock. So really, if we're talking about hair treatment protocols and everything, we're gonna give 6 months before we're really assessing if it worked or not. Anything sooner is typically just noise, and it's really hard to dial in if we're looking at on a week time frame. So let's talk about testosterone. Testosterone, DHT, and genetics. So let's clear up a major myth. Testosterone itself is not going to cause baldness. The issue is your follicle's sensitivity to DHT. DHT is formed when testosterone is converted by 5-alpha reductase. In genetically susceptible follicles, it shortens growth phase, shrinks the follicle, and converts thick hairs into thinner hairs over time. Same hormone, different responses. Think of it as sunlight. People who can sit in the sun all day and never burn, others are going to burn in like 5 minutes. The difference isn't the sun, it's the sensitivity. So if you're predisposed, higher androgen levels can accelerate hair loss. If you're not, you can have high testosterone your entire life and keep your hair. So in our clinic, we're going to focus on stability, physiologic dosing, avoiding peaks and crashes, because that hormonal chaos is more damaging than optimized physiology. I would say one of the most common treatment options I see all the time from HIMS is to put you on Propecia or Finasteride. This is a DHT blocker, and I can see the easy sell of it. It's like, hey, block this DHT, you're gonna keep your hair, it's gonna help your prostate. But we never block DHT. DHT is a very crucial hormone. It has downstream metabolites. It is more androgenic than testosterone, which is good for libido, brain health. It's a neurosteroid. It just happens to be more hard on people who are genetically prone in being DHT sensitive in their hair follicles. For the longest time, people will take it even prophylactically, even if they're not losing their hair, and it's overall just negative. You can get what's called post-finasteride syndrome, where you get permanent loss of libido problems. And so pulling you off of this a lot of times can improve how you feel day to day, improve libido, brain fog, everything. And it's just sold as a pretty benign medication that you really need to just be aware of what you're taking. And so that would be, I would work to, even though if you're losing your hair, still get you to come off the DHT blocker and then do different metrics to hopefully minimize further hair loss. The take home here is we just don't want to block such a powerful hormone that makes an impact on the rest of your physiology. Now let's talk about something that we also get questions on a lot. the GLP-1 medications like semaglutide, tirzepatide. Again, these medications do not damage hair follicles themselves, but they can absolutely trigger hair shedding. Why is that? Because they can rapidly change your physiology, and this leads to something called telogen effluvium. And this is where more hairs shift to the resting phase and then fall out 2 to 3 months later. And a few of the drivers with the GLP-1s are your body thinking that the weight loss is a stress signal. Your body thinks we're starving and hair is not one of our essential mechanisms to stay alive. So it's going to shed it as it doesn't want to devote further resources. The other thing that if you're not focusing on your protein, it's going to accelerate the problem. So GLP-1s suppress appetite, so people eat less, including protein. Hair is made of keratin, and if you don't have protein, you don't have any building blocks. So the next thing is you're getting less micronutrient shifts like iron, ferritin, zinc. Low ferritin alone can drive shedding. And so we check ferritin on our females, and it is not uncommon for us to find single-digit ferritin levels on a cycling female. And so if someone like that is put on a GLP-1 and their protein's not enough, they're going to be shedding at baseline, and it can be worsened along the way. So it's worth checking and getting your ferritin up and keeping your protein up. Also keeping micronutrients optimized as well. The fourth thing is hormonal shifts. And as you lose fat, insulin improves, SHBG increases, the androgen balance changes, and sometimes this can expose underlying genetic hair loss. So if you lose weight and you're improving your health and then your hair files a formal complaint, it's not that the GLP-1 caused hair loss by the med itself, it's just that the weight loss itself was poorly managed. And so what that would look like would be like backing down your dose so that you can get enough protein in and overall maybe slowing your weight loss progress, which, nobody wants, but to do it effectively and safely and to keep as much hair as you can, if we slow it down, sometimes your body's going to take it less as a stress response and hang on to it a little better. Let's talk about thyroid. Thyroid is a big driver of hair loss, and it can be caused by both high and low thyroid states. And so low thyroid slows everything down, so hair stays in the resting phase longer, becomes dry and bitter. And then high thyroid creates metabolic stress, increased cortisol signaling, and this speeds up the cycle, which leads to shedding. So hair and thyroid operate within a pretty narrow therapeutic metabolic window. So we're going to monitor pretty closely with TSH, free T3, free T4, and make sure that you're optimized without overdoing it, really letting symptoms guide us. And we'll kind of keep hair in mind at the same time, just so that we're not being overtreated. Another big component of hair loss and maintenance is actually blood flow and nitric oxide. I've talked about nitric oxide in another video and how important this is in terms of blood pressure, erectile health, and it has some hair benefits as well. And it's one of the most important pieces that are frequently missed. Hair follicles are metabolically active. They need oxygen, nutrients, hormonal signals, and these are all delivered through circulation. And so nitric oxide helps dilate blood vessels, improve microcirculation, increase nutrient delivery. This is one of the reasons why Minoxidil works. We'll get to more on that shortly, but you can have perfect hormones, but if the blood flow is poor, the follicle is not going to get what it needs in terms of the building blocks. You can't grow hair from a poorly perfused scalp. Let's now move to some of the interventions that do help improve hair thickness and growth. And we'll start by minoxidil. This is classically the Rogaine. It's been around for a long time. It works by improving blood flow, opens potassium channels, and so it prolongs the growth phase. There is topical minoxidil, the shampoos, the foams, the creams, and it works well. Side effects can be scalp irritation, dryness. It kind of sucks to apply every day. Oral minoxidil came first, and it is still decent in terms of overall hair management. We just use tiny doses. It's more consistent to just take a pill. It's not as oily or greasy. And so it's typically more effective, but it's systemic, meaning it's going to affect your entire body. So what you do have to monitor with it is your heart rate, your blood pressure, make sure you're not retaining too much fluid. Side effects of this can be swelling, lightheadedness, unwanted hair growth in other places other just than the head. So it has some use. At the higher doses, they had some like pericardial effusions, and so I wouldn't use it if anybody has any of those kind of history or anything. But the next thing that works well and that we do at the clinic is microneedling. Microneedling creates controlled micro injuries, and so this stimulates growth factors, improves the blood flow. It enhances absorption of topicals if you're using any. We will do kind of deeper in the clinic where we'll use numbing cream, and we'll do this every 4 to 6 weeks. You can do it at home. You can use a little stamper that can get some stimulation. It can be painful, so a lot of times that's going to be limited on kind of pain tolerance. But side effects of microneedling is redness, discomfort. If you're pushing and you don't have proper hygiene, there's a risk for infection. It is very controlled. More is not always better if you're just slicing up your entire head. You're not tenderizing a steak, so it is done in a controlled manner. Typically, we pair the microneedling with PRP. So platelet-rich plasma, where we draw your blood, spin it down, draw the liquid part. PRP, PRF, both are really good, and they help deliver growth factors that your body already made. PDGF, VEGF, other signaling molecules, and this really helps improve thickness, support follicle health. It can potentially reactivate miniaturized follicles. It has really good evidence, and it can really help. Side effects with this are pain with the injection, bruising, cost. It is a procedure that we charge for. Red light therapy is another thing. They have helmets that you can wear at home, and so that may help. These low-level laser therapy may work by improving mitochondrial function, increasing cellular energy, pretty low risk and minimal side effects. And it's a good addition. It's typically not something I'm just recommending by itself to fix your hair loss. So another thing that helps is ketoconazole shampoo. I mean, it's anti-dandruff. And so if you have dandruff, you can knock out 2 birds with 1 stone. It helps reduce inflammation. It improves scalp health. It has very mild local anti-androgen effects. And it is something that, is just kind of turning the volume down slightly. Again, there's nothing crazy about any of this stuff, but all the little things can add up together. And really, you only have to do it 2 to 3 times a week. Leave it on for 3 to 5 minutes at a time. And it's not going to regrow your hairline, but it's going to create a better environment. Microneedling at home, I kind of mentioned it earlier. It's going to stimulate growth factors, improve blood flow. And like I said, I like the stamper over a roller because a roller kind of drags and doesn't get quite the stimulation that we're looking for. Really at home, it's based off tolerance. So you're just doing real tiny, like 0.25 to 0.5 millimeters. You do this every week or so. Again, consistency with these matters more than intensity. Just because you're going much deeper at home more frequently doesn't mean that you're going to get more out of it. Just find a routine that you can be consistent with. Some supplements that help. Again, supplements don't really override genetics, but they can help support your own biology. So we focus on ferritin, vitamin D, protein intake, your omega-3s, collagen. These aren't going to be the thing to really get at anything to regrow, but it's going to overall make your hair quality better. Biotin can help. It's typically best if you're deficient, and most people aren't, but it is typically part of protocols. And like we use Nutrafol in the clinic, which is a brand name hair multivitamin, and it's pretty good. It's another good adjunct that just kind of provides all the building blocks to hair. And so I will if anybody's working on hair monitoring or maintenance, we'll typically put Nutrafol in as a supplement for their hair. GHK Copper is a copper peptide involved in tissue repair, and it helps support collagen, blood flow signaling, anti-inflammatory pathways. It improves the environment, but it doesn't force growth. There are human studies that use it topically, and it works well as an adjunct, especially with microneedling and everything. There's an injectable form. Again, peptides are getting really popular, and an injectable is very much promoted through these peptide sources. And this is one of the areas that I've talked about with other peptides that it's just, there's not a lot of human grade evidence on it. And as I've mentioned in the past, I don't like using research grade chemicals or the not for human use peptides because they have zero regulation. Nobody's monitoring for endotoxins or dosing or quality or anything. And so will never recommend them. If we're going to use it, we'll use it from a compounding pharmacy. But the injectable GHK copper doesn't have very much human data for us to guide. And so that's kind of one of the ones that falls into the experimental. The possible risks with this that we're aware of are injection reactions. It does sting as an injection, so post-injection pain, infection with any type of injection, contamination if it's a research-grade chemical, unknown long-term effects because we just don't have the data to confidently say what happens if you inject this for a long time. And so we'll use topical more readily than we would injectable just from the amount of data we have. But let's talk about realistic expectations. Again, hair works in the 90 to 120 day cycles, and so it just takes time. Really, 6 to 12 months is really what we're looking for. And hair is, again, tough. It's so genetically mediated that not everyone's going to regrow full density hair what they once had. The goal typically is to slow the loss, improve thickness where we can, preserve what you have. And stabilization is a win. If we're preventing further loss, honestly, that's a win in itself. And so this is not hair TikTok. There's no 30-day transformation. We're talking in months, even up to years for hair maintenance and everything. The last thing, if you are just really dedicated to your hair, this is typically for guys, but if you're just really needing your hair to be a part of you, it is part of your identity. Hair transplant is an option. There are the stuff in like Turkey where you can fly, get it done, come back. It's reasonable. There are places in the US that do it as well. So hair transplant can be an option if you're just really dedicated and don't want to lose your hair. But, the big takeaway from all this, if you're dealing with hair loss, don't just try one option. Look at the system, your hormones, your thyroid, your nutrition, your blood flow, your stress levels. We can talk about regenerative therapies with PRP. If you want to experiment a little bit, the GHK Copper. But whenever you're hitting it from multiple areas and when all those align and you're consistent with it, that's when the outcomes can actually change. Hair loss isn't random, it's physiology. And physiology can be optimized. And so once it is all optimized, let's hit it from a few different areas and just give the best possible outcome that we can and try to put genetics the lowest tier we can. It's just a lot of times it's hard to outdo genetics. If you're dealing with hair loss and want some potential treatment options, reach out and we can kind of work through each of these and see what may be best for you.